Cystic fibrosis.
Cell-to-cell communication. Cells send signals to each other. These include local and long-distance signaling. In long-distance signaling, there are 3 stages. The first one is reception, where the hormone binds to a receptor. The second stage is transjunction, in which the binding leads to a change in the receptor that triggers a series of changes along the signal transduction pathway. At the end of the transduction pathway, the cell creates a response.
General information. Yay! What is cystic fibrosis, you might ask? Well, as you might have guessed, we are here to tell you. Cystic fibrosis, CF for short, is a chromosomal mutation that causes a defect in the exocrine system. The glands of the exocrine system are responsible for secreting substances such as sweat and mucus. The CFTR gene makes a protein that controls the movement of salt and water in and out of the cells. In patients with CF, this protein is defective. This causes thick, sticky mucus to accumulate in the lungs and very salty sweat. The gene mutation for cystic fibrosis is located on chromosome 7. The phenylalanine codon is deleted from the chromosome in most cystic fibrosis cases.
Cystic fibrosis is caused by mutations in the cystic fibrosis transmembrane contents regulator, of CFTR. When a CFTR mutation occurs, chloride ions are unable to cross the membrane of a cell, resulting in heavy mucus. In a person that doesn't have cystic fibrosis, this protein would allow the chloride ions to cross. In cystic fibrosis, the G protein pathway is affected. In a healthy person, the hormone would bind to the receptor, which would lead to the G protein binding to the receptor. And the G protein would go back to the enzyme with the signal. However, in a cystic fibrosis patient, the CFTR gene has a mutation and doesn't allow the G protein to bind to it. So the G protein can never bring the signal to the enzyme, and thus the signal is never transmitted.
There are many symptoms for CF, including respiratory, digestive, orthopedic, reproductive, and nutritional, and physical characteristics that are affected. In a CF patient's respiratory system, they may experience inflamed nasal passages, a persistent cough with sticky mucus, wheezing, chronic lung infections, an exercise intolerance, or breathlessness. The average CF patient might experience severe constipation or intestinal blockages, both of which have to do with each other, and may also experience foul-smelling greasy stool, and overall do not gain weight well or grow well. CF patients are at a higher risk of getting osteoporosis later in life, and men who are ailed with CF are infertile, and women, though they may be fertile, might have a harder time becoming pregnant due to their increased risk of contracting an infection. CF patients also have a hard time absorbing nutrients due to a faulty manufacturing of a protein and enzyme that absorbs the protein, starches, and fats one needs to survive. So they also experience general malabsorption. Although CF patients do not look that different from the average person on the outside, they may include some finger clubbing or have a frail frame, again due to the malabsorption, and they may just be generally smaller than the average person. These are our references.